Calculus, sometimes called tartar, that is under the gums, may cause bone recession. The bone recedes and moves away from the calculus because of the associated inflammation. The calculus grows on this newly exposed area and the bone recedes further. This vicious cycle can continue to severe levels. If there is not associated recession, it is often unnoticed by the patient. With tooth loss, there will be bone atrophy. This movie demonstrates how we can correct posterior vertical bone loss with the use of distraction osteogenesis. Bone screws to hold the distraction appliance to the mandible are first marked, being careful not to engage the mandibular nerve. Then the top part of the remaining bone is severed from the rest of the jaw. It is severed, leaving some cancellous area in the middle still attached. This piece of bone needs to be superior to the mandibular nerve. The appliance is then attached with bone screws both to the remaining bone and the severed piece of bone. This animation shows the bone view where the area will be covered with gums. At this point, the top part of the appliance will protrude from the gums and will be activated with a rotating device. This will be done once or twice a day for approximately 2 weeks. The idea is that the area still has blood supply and is stabilized by the distraction of appliance. In addition, it acts like a sandwich graft without any bone placement between the two pieces. At the end of the distraction process, guided tissue regeneration can then be used to fill in the voids created at the corners of the newly created space. However, this is not always needed. Over a period of 6 to 9 months, the newly created area fills in with bone. The appliance can then be removed and implants can then be placed to restore the area. In this animation, we see the clinical view of the distraction appliance in action. The deficient area is corrected as the appliance is being adjusted. The appliance is adjusted in small increments over a large period of time. Therefore, this can take several months. At the end of treatment, the gums are retracted and the appliance is removed. The implant fixtures can be placed at the time of appliance removal. In this demonstration, the implant fixtures are placed in one-stage type of placement where the healing cap is placed at the same time as the implant fixtures.